It's not that I'm away at home suffering from all these infections and cannot cope every day. I actually am very active. I'm a marathon runner. The process has been uncomplicated for me. They explain what they are doing, when they're doing it. So it's a very high-grade medical operation, but it's no stress for the actual patient like myself. So the process is very simple and straightforward. It's pain-free. There is no pain apart from obviously the first couple of minutes of getting a needle into your arm. It wasn't like I was in a really bad situation, but I think for anybody who's wanting to look at being proactive, looking at longevity, looking at what's good for your body, stem cells is an obvious choice.
First of all, good afternoon. Thank you so much for your time. Please introduce yourself first of all, and tell us what brought you to Swiss Medica for the first time.
Okay, so after having carried out a number of blood tests for a 5 or 6 year period, I realised I had low immunoglobulins, but I was an outlier that I didn't have recurring infections. So I wanted to be proactive about the situation in case that happened later. So I did some research and found that there may be a connection between stem cell therapy and improving your immunoglobulin levels. And I ended up finding Swiss Medica for treatment. And I came first of all here in 2022, and I stayed for 18 days. And I had lots of treatment then, and I'm back again now for some follow-up tests and for some further treatment.
So you've been to our old clinic and now you're in a new place.
Yeah.
Is it in comparison with the old one? How do you find it?
In general, the new premises are significantly bigger. You can see it right away when you come. The old premises were fine. I mean, there was quite a homely aspect of the old premises. I thoroughly enjoyed being there. It was all really good. But I can see even like the physio unit, it's 4 times bigger. It just feels like it's a bigger, better open space. Also, the treatment room is significantly bigger. It's good that a lot of the staff that were here the first time are still here, including Maria, Tanya and other nurses. So it is good that way, and that is one way that I judge a business. If the same people are staying in the company, then there must be a loyalty, and they must be doing good things to retain their staff and looking after it. And I must say the staff are fantastic.
And Ivan, oh, you forgot about Ivan.
The physio suite with Ivan and all the other staff in there, they have been phenomenal looking after me.
Okay, let's talk about the changes that you have noticed after the first treatment, because obviously there was something that brought you here for the second time to repeat the treatment. So when you started noticing it, and what were they? So
I suppose I'm in maybe a rare case where I am being incredibly proactive about this. I wanted to know what my blood results were at a very low level. So there's multiple levels of when you do blood tests to understand what's going on. And I think only with being able to come back to Serbia again and do those tests and receive some treatment when I was here. It's not that I'm away at home suffering from all these infections and cannot cope every day. I actually am very active. I'm a marathon runner. I've done 18 marathons so far. I'm supposed to be doing Boston in April, assuming my knee's okay. So it wasn't like I was in a really bad situation, but I think for anybody who's wanting to look at being proactive, looking at longevity, looking at what's good for your body, stem cells is an obvious choice. There is a lot of good research out there to show that it's a good thing to be doing. And I'm, I suppose, fortunate that I sold my business 5 years ago and I have more time and the ability to come and do stuff like this. So it's more a case of the proactivity, and I think everybody should be proactive in their health, because it's so easy to turn up one day and go, oh my God, how am I going to fix this machine because it's broken? I'm trying to stop hitting that time where I still feel active in my 60s and beyond and still feel healthy. And this is a fundamental part of feeling healthy and feeling like when grandchildren come along, I can be able to be active with them rather than the guy sitting in the corner of the room getting a cup of tea handed to him. I don't want to be that guy. I want to be the guy running ahead of the kids.
Tell us, please, Some people, when they hear stem cell treatment, they imagine something in their head, like some operation or something like that. What is it, the process? Is it easy? Is it complicated? Are our doctors and nurses capable of doing this, knowledgeable enough to do these kind of procedures? What is stem cell therapy? Like how do people get stem cells?
It's very, very simple. You have an infusion, so it's an intravenous connection into your arm. You have a bag which contains the stem cells. Over a short period of time, they are released into your bloodstream. So the process is very simple and straightforward. It's pain-free. There is no pain apart from obviously the first couple of minutes of getting a needle into your arm. But the doctors are very capable and very confident. I also did a process called plasmapheresis, which is the cleaning of the blood for heavy metals. And likewise, very simple and straightforward to do. But the biggest effort you have to make really is to lie on a bed. So if anybody's asking you, can you lie on a bed? Well, that's pretty easy to do. The rest is straightforward. The process has been uncomplicated for me. They explain what they are doing, when they're doing it, double checking all the time that what they're going to give you is absolutely for you by checking your name, double checking your name, and another member of staff doing the same. So it's a very high grade medical operation, but it's no stress for the actual patient like myself.
Do you need time for a recovery? Like, can you be active during the day after you receive the stem cells, or you need to be laid down in bed? Like, how did you feel?
I was fine. First time I was here, I was active every day. I didn't need to go and lie down. There was only one incident where I felt a little sick for a while, a couple of hours, but they explained that happens when you first receive. So a little stomach cramp, lay down for a few hours, that was fine. No reoccurrence of that. One, I suppose, other aspect was I became opportunistic and asked for some targeted stem cells on my knee. I tore something in the back of my knee, meniscus, and they very quickly adopted the protocol that I was going to receive and said yes. I only told them 2 weeks ago. They said, yes, come along, we can do targeted stem cells to your knee, because I obviously want this to be repaired to be able to run Boston in 10 weeks' time. And that has gone well, but it just meant I had to keep off my feet for 24 hours with a little pain associated. But, you know, in the pain scale, it was 5 or 6 out of 10 and went away to 3 out of 10 fairly quickly. So, you know, that was the only pain that I had received while here the second time.
What should one do if he wants to apply for stem cell therapy with us? How did you find us?
How to find it? Very straightforward. I Google. You very quickly find that Swiss Medica are a reputable and established provider. You can see a lot of the case studies and references online, so you can get proof of people who live in your own geography that they have been here and have had a good experience, similar to myself. So it's a case of putting out a request. The request is straightforward. I filled in my details. Within 24 hours, I was talking to someone. Within a few days, they were reading my records, and I was posting all my medical reports. And within a couple of weeks, I had a proposal as to what the treatment would be. So that aspect of it was very straightforward.
A little bit about the question I'm asking next is for those who have some fear coming to Serbia. A little bit about your own experience in Belgrade.
I have had a great time. I would have no reservations about saying to somebody to visit Serbia. Belgrade is a lovely city. I visited it a number of times, and I'm actually going to go back hopefully tomorrow for a 3-hour walking tour. So, you know, the people are very friendly. And in certain ways, they remind me of the Irish, their openness, their ability to just chat and say hello. Everybody wants to help you. Obviously, that's more magnified in Swiss Medica here because they're seeing you every day. Out and about, you maybe need to make more of an effort to get to chat to somebody. But everybody has been helpful. I would have no fear about visiting Belgrade, visiting Serbia, and there's regular flights from the UK. So it's not a problem, and I have not found a negative reason
Mm-hmm.
for visiting Serbia. I don't have any.
Patrick, have you got any advice in a sleeve for those who are hesitating to try the stem cell therapy, to come to Serbia or to go to some other clinic?
My advice is, you know, take the feedback from all the other people that have been on the same journey, because they're the people who can give you the honest truth. It's very easy to be negative about it and say, oh, you don't want to do that, it's not recognized by doctors, or, you know, why would you go to Serbia? I mean, listen to all the other people that have been here. The vast majority are very positive about the experience, have had great feedback and results. So I think my advice would be just do it. You know, obviously there's a cost element to it, but that can be facilitated by paying it off maybe over a period of time. What's more important? You're looking after your health, or, you know, as we say in Ireland, your health is your wealth. That's it. So invest in it.